Good afternoon, guys. I've got discussion C for you. We're discussing breakthrough in stuttering treatment, deep brain stimulation case study. Okay, here we go with the presentation I made for you. Give me a second to set up for the show, and I'll get going on that for you. Okay. A pioneering clinical case from Germany has opened new possibilities for treating persistent developmental stuttering using deep brain stimulation, or DBS technique, more commonly associated with movement disorders like Parkinson's disease. In this instance, neurologists from Glasgow, the University Frankfurt, and Munster University Hospital implanted a hair-thin electrode into the left thalamus of a man with severe lifelong stuttering over the course of several months. The patient experienced dramatic 46% reduction in stuttering frequency alongside a marked disease and severity. Why the left thalamus was chosen. The left thalamus was selected as the stimulation site because on decades of neuroimaging and physiological research influenced speakers. The left auditory cortex and left motor cortex work in tight synchronicity to process and produce rapid speech signals. However, in people who stutter, this interaction is weakened. As a result, the brain often compensates by shifting speech processing to the right hemisphere, an area less suited for handling first sequential auditory motor tasks. The thalamus, located deep within the brain's axis as a central relay hub, and is capable of modulating these cortical interaction by stimulating the left thalamus. Researchers aim to restore more efficient communication between the auditory and motor regions of the left side. Demonstrating a true biological effect. To rule out placebo effects or psychological expectation, the research team conducted a blind test. They turned off the stimulation without informing the patient. The result was telling. His stuttering worsened again, confirming that the improvement was biologically driven by the stimulation itself. This kind of controlled withdrawal is a gold standard neuromodulation research. Offering compelling evidence that the brain speech circuitry was being directly influenced. A typical response compared to Parkinson's DBS. Increasingly, the patient's response to DBS differed from the typical pattern seen in Parkinson's disease. In Parkinson's, tremors often return immediately when stimulation is stopped. In the case the stuttering increased to its original severity. Researchers speculate that the patient's experience of fluent speech during stimulation may have helped him and his brain developed compensatory strategies that sustained partial improvement even after the device was turned off. This suggests a possible synergy between neuroplasticity and neuromodulation, where the brain learns from the altered state and adapts, risks, cautions, and future directions. Despite the promising results, the researchers are careful to temper expectations. Deep brain stimulation is a major surgical procedure involving risks such as infections, bleeding, and unintended neurological effects. It is not a universal solution and must be considered only for individuals whose stuttering cases or causes significant distress and who have exhausted other therapeutic options. The team is now preparing broader studies to assess whether DBS can benefit others with severe stuttering and whether similar effects would be achieved through non-invasive methods like transcranial magnetic stimulation or TMS or transcranial direct current stimulation TDCS. Publication and broader impact. The case study published in the Journal of Fluency Disorders marks the first documented instance of successful DBS for stuttering. And it challenges long held assumptions that stuttering is purely psychological and underscores the role of brain circuitry in speech fluency. As the field moves forward, this work could reshape therapeutic approaches and offer new hope for individuals living with chronic speech flow disorders. Okay, guys, so that is C for you. I'm going to take a little break and I'll be back on with D shortly. For now, Gator Wellness, take care, folks.